The 3M SNAP therapy system is indicated for patients who would benefit from wound management via the application of negative pressure, particularly as the device may promote wound healing through the removal of small amounts of excess exudate from chronic, acute, traumatic, subacute, and dehisced wounds, ulcers, and surgically closed incisions, flaps, and grafts. When treating a chronic low exudating wound, it can be beneficial to use a dressing that positions the port and the tubing away from the wound to minimize the chance of additional pressure points. The SNAP bridge dressing is a good choice for delivering negative pressure wound therapy for low exudating wounds. The SNAP therapy system includes the 3M SNAP therapy cartridge, 3M SNAP therapy strap, 3M SNAP bridge dressing kit, and the 3M SNAP Securing Hydrocolloid Skin Barrier. Begin by preparing the wound bed and the peri-wound skin according to institution protocol and irrigating the wound bed thoroughly with normal saline. If necessary, apply a skin protectant to the surrounding skin. Next, cut the foam interface to fit the size and shape of the wound. Next, we will use the SNAP Securing Hydrocolloid Skin Barrier to make the dressing application faster and easier. It can be molded into uneven skin surfaces or challenging body contours, filling these voids and reducing potential leak paths. Prior to applying, make sure the skin is clean, dry, and free from any solvent or greasy substances. Remove the SNAP Securing Hydrocolloid Skin Barrier from the packaging and remove the release liner from both surfaces. Gently mold, stretch, compress, or roll it to any shape to fit around the outside of the patient's wound. It may be pulled apart and rejoined to better fit around the patient's wound. Gently apply to intact skin around the outside of the wound with light pressure. Ensure there is at least 1 centimeter of intact skin between the wound border and the SNAP Securing Hydrocolloid Skin Barrier. Place the hydrocolloid of the SNAP bridge dressing over the wound and seal. Ensure that the diamond mark on the bridge section is placed over the foam interface. Trim hydrocolloid if necessary. Place the foam interface into the wound cavity. Foam interface should fill the wound cavity and extend above the wound margins. To begin application of the SNAP bridge dressing, peel away the release liner as you carefully place the SNAP bridge dressing over the wound. Ensure the center opening of the port is placed directly over the foam interface and carefully apply the dressing over the wound. The dressing should be adhered to at least 1 centimeter of intact skin to maintain a proper seal. Smooth out the hydrocolloid dressing onto the skin and remove any small creases. Next, remove the side release liners one at a time and carefully press the rest of the hydrocolloid dressing to the skin. Use your hands to smooth out the dressing to ensure an airtight seal to the skin. It is often helpful to hold your warm hands over the dressing to allow the adhesive to properly adhere to the skin. Route the bridge section of the dressing to a location away from the wound. Cut the dressing tubing to the desired length. Connect the SNAP therapy cartridge to the tube fitting using both hands. Fully insert the tube fitting into the tubing. To activate the SNAP therapy cartridge, press down on the activation reset key and pull it out. Reinsert and repeat as needed until an airtight seal is obtained and the red pressure discharge indicator is not visible in the pressure discharge window. To enable greater patient mobility, secure the SNAP therapy cartridge to the patient's extremity or belt using the SNAP therapy strap. The SNAP therapy system is working properly if the green capacity indicator is both visible and stationary in the chamber window, the dressing has a sucked-down appearance, and the dressing feels hard to the touch. Remember, at a minimum, the SNAP therapy cartridge should be inspected once every 8 hours. It is recommended that the dressing be changed at least 2 times per week, with frequency adjusted by the clinician as appropriate. For more product demos and application techniques, visit 3m.com/medical.